Hi, this is Monica Oberg. I'm the clinical social worker at Pediatric Home Service in the Roseville office. Today's training is about abuse and neglect. It's a very tough subject and one we need to address every year. The information is not new to me, but I always find myself struggling while working on this topic. Please take care of yourselves, pause the training, and come back to it as needed. If this triggers any past trauma, make sure to seek out your resources. The objectives for the 2020 Abuse and Neglect Training include PHS's position on abuse and neglect. You'll be able to understand the warning signs of abuse and neglect, define and identify the different types of abuse and neglect. We will review signs and symptoms of abuse and neglect, and you'll know what to do should you see or suspect abuse and/or neglect. Pediatric Home Service strictly prohibits any and all forms of abuse or neglect by staff towards children or vulnerable adults in our care. Any substantiated claims of such will result in immediate termination. Some warning signs for abuse may include being unable to control your anger, feeling emotionally disconnected from your child, feeling like meeting daily needs are impossible, friends or family members are expressing concerns for you. Did you know children living in poverty are 7 times more likely to be neglected than other children? Other factors that precipitate abuse in children include adults' difficulty bonding with a newborn child, their own history of maltreatment, lacking awareness of appropriate development in children. They might have unrealistic expectations of a child. There may be drug or alcohol use in play. They lack a support network. There might be untreated mental illness. There might be financial difficulty, an involvement in criminal activity, domestic violence, or inadequate housing. Child abuse is when a parent or caregiver, through action or failing to act, causes injury, death, emotional harm, or risk of serious harm to a child. A vulnerable adult is a person 18 years or older who receives certain services from a qualified provider or, regardless of services provided, possess physical, mental, or emotional infirmity or dysfunction. There are 5 categories of abuse. They include physical, emotional, sexual abuse, neglect, and exploitation. The definition of physical abuse includes any intentional act causing injury or trauma to another person by way of physical contact. This diagram will help me talk about any concerns we might have or red flags to physical abuse. Concerns are raised by injuries on both sides of the body, any injuries to soft tissue, injuries with a particular pattern, any injury that doesn't fit an explanation, it delays in presentation, or it's untreated. If you're seeing any bruising or marks around the ears, and it looks like maybe pinch marks, that might be a red flag. The triangle of safety includes the ears, the side of the face, neck, and top of shoulders. Accidental injuries in this area are pretty unusual. If you're noticing black eyes, especially if they're bilateral, if you're noticing any bruising or marks in the forearms such as raising your arm up to protect themselves, any bruising in the chest or abdomen area, the inner part of a child's arm or a vulnerable adult, the back and the side of the trunk, except directly over the bony spine, any bruising around the groin or genital area, or the inner parts of a thigh, or the soles of the feet. These are all red flags to physical abuse. In our last slide, we talked about red flags of physical abuse. Now we'll talk about typical accidental injuries. Accidental injuries typically involve bony prominences. They match the history. They're keeping with the development of the child. Oftentimes, we know kids with bruising on their forehead, nose, chin, palm of hands, oftentimes the elbow area, the knees, and the shins. Here you can see a few examples of bruises and marks that would be cause for concern or a need to report due to the location and patterns of the injuries. In a study about bruises in babies, they found that almost 21% of kids younger than 3 years of age had bruises without any known medical cause and no suspicion of abuse. What they found was children who aren't moving around, such as walking, scooting, or crawling, don't bruise. This would include our non-mobile kids. Bruises on the forehead and upper leg were common among walkers. Bruising on the face and trunk were rare. Bruises on the hands and butt were not observed at any age. When an object is used, the shape or pattern is often left on the skin, such as a hand or a belt. These patterns are rarely confused with medical conditions. In regards to falls, it should not result in more than one bruise or bruising in more than one area. It's important for us to document bruises that we're noticing in our patients. They may be due to their medical history or intervention, but it may be something else. Documentation is always important. Emotional abuse is defined by a pattern of behavior that attacks a person's emotional development and sense of self-worth. Signs of emotional abuse include constant belittling, shaming, and humiliating, calling names and making negative comparisons to others. Statements such as, "You are no good," "You're worthless," "You're bad," or "a mistake." Frequent yelling, threatening, or bullying. Ignoring or rejecting as punishment, giving them the silent treatment. Limited physical contact, no hugs, kisses, or other signs of affection. In addition to these, exposure to violence or the abuse of others can be considered a form of emotional abuse. Sexual abuse is usually undesired sexual behavior by one person upon another. It is often perpetrated using force or by taking advantage of another. The term also covers any behavior by an adult or older adolescent towards a child to stimulate any of the involved sexually. More than 70% of child sexual abuse cases involve a relative, friend, or someone else close to the child. A child who displays behavioral changes in extremes, which is opposite to their natural behavior, is a sign and signal of sexual abuse. Some others include a child who exhibits fearful behavior, has nightmares or trouble sleeping soundly, or they may wait for something bad to happen as if it's a routine. They want to be secretive or want to be left alone. They all of a sudden have had poor self-image. They have a difficulty walking, sitting, or going to the bathroom. Or they may be overly suspicious or watchful and who either avoids or inappropriately invites physical contact. This slide breaks down signs and signals of sexual abuse into age categories. Some things to point out is if any child is disclosing that they've been sexually abused, please listen. There's no need to investigate. This is reportable right away. If any child under the age of 12 has an STD that you're aware of, that's reportable as well. For a child under 5 to start having sexual drawings, that's a concern. For a child between the ages of 5 to 12 years old, if they're having any suicide attempts or running away or starting to abuse alcohol and drugs, that's quite young and a concern. And for a child 12 and a little bit older, if there's any kind of prostitution or self-mutilation, those are big concerns as well. Neglect is when a parent or caregiver does not give the care, supervision, affection, and support that is needed. Signs for neglect include those for children and vulnerable adults. Neglect often requires a pattern of behavior over a period of time. There is no typical neglectful parent. They often display indifference or lack of care toward the vulnerable person. There might be depression, apathy, drug or alcohol abuse, or other mental health issues. They may deny problems with the vulnerable person or blames that person for their problems. They view the vulnerable person negatively, and they may rely on them for their own care and well-being. There are 4 categories of neglect. They include physical, which is a failure to provide a child food, clothing, or shelter. Emotional is failure to provide adequate nurturing or affection to a vulnerable person. Educational is a failure to ensure a child is educated according to the law. Medical neglect includes failure to apply the appropriate medical care. PHS sees medical neglect the most. We are highlighting medical neglect during this training as it's something that we frequent the most at PHS. Medical neglect is a failure to provide necessary medical care, means refusal, failure to seek, failure to obtain, or failure to follow through with necessary medical care if there's serious risk to a child or vulnerable adult. Examples of medical neglect include not taking a vulnerable person to a hospital or appropriate medical professional for serious illness or injury, keeping the vulnerable person from getting needed treatment, not providing preventative medical and dental care, and failing to follow medical recommendations. As I stated previously, medical neglect is our biggest concern at PHS. We want to make sure to identify and address barriers as they come up. Some common ones include transportation or financial concerns, but we also want to consider any type of family chaos, lack of awareness or skills, a distrust of medical professionals, their culture, and so forth. It's very important that we're documenting that the family is aware of the importance of medical care and risks of not providing necessary care. We also want to document any conversations we're having or education we're providing to the family. We may consider a contract with the family. And we also want to provide ongoing communication with the following doctor with clear benchmarks of when the child should be seen again. Exploitation has 2 subgroups, sexual and financial. Sexual exploitation is the use of a person for profit, power, or sexual gratification. Financial exploitation occurs when a person misuses or takes the assets of a vulnerable adult for his or her own personal benefit. Financial exploitation frequently occurs without the explicit knowledge or consent of a vulnerable adult, depriving them of vital financial resources for their personal needs. An example of this that I've helped with since being at Pediatric Home Service includes one of our patients who is unable to go to the store on their own. He gave his debit card to PCA so they could pick up items our client needed. The PCA bought these items, but also took cash out for their own use. Sexual exploitation can take many forms, including these examples: sex trafficking, using a child for prostitution, taking pictures of a child for pornographic use, denying age-appropriate privacy to a child who is dressing, undressing, or using the bathroom. Signs of financial exploitation include new bank accounts or unusual bank activity that the vulnerable adult is unaware of, or removing any valuable items from a vulnerable adult's home without their approval. When we have a concern about a family or client that we're working with at PHS, we want to make sure we remember that we are not investigators. When we're talking with families, we want to make sure we talk a little and listen a lot. We're going to document the description of injury or concern. If there's any physical abuse that we are concerned about, we would want to make sure to identify caretakers and adults present at the time of injury. And then if there's any quotes from caregivers or family, we want to make sure to write those down to help frame the situation. So now that you're aware of signs and symptoms about abuse and neglect, you're wondering, what should I do? Bottom line, if you see or suspect any form of abuse or neglect, please report it. This is the key takeaway we want each of you to hear today. Report it. Again, if you see or suspect any form of abuse or neglect, report it. Report it to a supervisor, report it to the social worker, report it to the area CPS. Make a report. All staff who work at Pediatric Home Service are mandated to report abuse and/or neglect of a patient to an appropriate licensing agency. Factual observations regarding concern will be documented in the medical record. Reports of abuse or neglect are not documented in the medical record, but through a CSER marked confidential. See M-Files 381 for detailed information on our policy. We will also be looking at that in the next few slides. The medical component that we provide is just part of the needed response to potential maltreatment. Cooperation and communication with following medical providers. Cooperation with official community agencies is crucial and legally mandated. Communication with CPS and law enforcement is legal and protected. Communication with CPS and law enforcement takes precedence over HIPAA. It's never wrong to make a call if you have a concern. Please know you do not need permission to make a report if you have a concern. If you have a concern, you can call the Child Protection Services in your area, MCRC for advice. However, if you want to talk it through, speak with your supervisor, speak to me, the social worker, or check in with a coworker. Sometimes it's nice to talk to others to make sure it's not just a judgment call or cultural differences. Detailed reporting guidelines to include state-specific information can be found in M-Files 381. If you would like assistance with the official reporting process, please speak with your supervisor immediately for support. This slide breaks down the difference between law enforcement versus child protection. Law enforcement is responsible for investigating crimes. They must identify a suspect. They must prove their case beyond a reasonable doubt in criminal court. They're available 24/7, and case assignment is dependent on where the crime occurred. Child protection primarily is concerned with things that happen within the family. They need not necessarily identify a single suspect. They must prove their case in civil court with a preponderance of evidence. They might not always be available 24/7. Case assignment is dependent upon where the child lives. If you or your patient are in immediate danger, make sure you're calling the police. If you're in danger, please leave the home. When you're making a report, make sure you're reporting what you see and assess. Sometimes a concern is more about education. Some concerns aren't reportable right away, and we need to show a pattern. Make sure you're not investigating or looking for further information. PHS provides employees with resources as guidance in making a report to the appropriate agency. Use of the following resources is not mandatory. Employees are encouraged to make immediate and direct contact with the appropriate agency as soon as they have a concern. Some internal resources an employee has includes the PHS manager, case manager, or social worker, and they can help in guidance in reporting. There's an internal form for documenting concern. It's titled the Abuse and Neglect Report. This form is available for employees as an optional tool to gather information and document the concern in preparation to contacting the appropriate agency. This form is not a part of the medical record. Midwest Children's Resource Center is another agency that can help us, specifically with any gray areas that we are faced with. The employee may contact MCRC for guidance in reporting. Their phone number is 651-220-6750. Again, your go-to resource for all things abuse and neglect related is MFiles 381. Some of the resources you'll find there include the policy, the purpose, definitions, reporting instructions, including state-specific instructions, statistics, and additional information and resources. This information is heavy and full of detailed information. If you ever have any concerns or questions regarding one of your families or clients, or any information from this training, don't hesitate to seek me out. I can be reached in the office at PHS, via phone, email, or in-person visits.